In male genital system, or we can say male reproductive system, we have some structures that are located outside the pelvic cavity. For example, here we have scrotum and penis, both located outside the pelvic cavity. Scrotum is a sac that is attached to the root of the penis, and it's covered by skin. Under the skin, we can see subcutaneous layer, which is filled with adipose tissue, fat tissue. And in subcutaneous layer, we find some smooth muscles that we refer to them as dartos muscles. Dartos muscles contract when this area is cold, and contraction of dartos muscles makes scrotum tight. That reduces the heat loss from scrotum. Deep inside the scrotum, we have a wall that separates scrotum into two compartments, right and left side, and we name that wall scrotal septum. In the scrotal septum, we also find some dartos muscles. And when we look at each compartment of scrotum, inside each compartment, we find one of the two testes. I'm pointing at the left testis at the moment. And as you see, above and behind testis, we have a comma-shaped organ, which is called epididymis. Inside the testes, we have spermatogenesis, which is the process of producing sperm. In humans, spermatogenesis usually takes about 65 to 75 days. And when sperms are produced from testes, sperms are pushed into epididymis. Inside testes, spermatogenesis happens inside some very small narrow tubes named seminiferous tubules. So in short, we say spermatogenesis happens in the seminiferous tubules of testes. When sperms get inside epididymis, this is the place that we also have some long coiled tubes, and inside those tubes, sperms become mature. When we say sperms become mature inside epididymis, we mean sperms acquire two skills. One, they learn how to use their flagella and move, swim. Two, they learn how to fertilize an ovum. And maturation of sperm inside epididymis takes about 14 days. On daily basis, the testes of a male produce about 300 million sperms. So clearly, when testes produce such a large number of cells, we need to have storage for these sperms. Epididymis is a place that we can store sperm for several months. Some resources suggest that inside epididymis, sperms can be stored up to 6 months. If sperms are not ejaculated during this time frame, they are considered old sperms, they degenerate and will be reabsorbed. So, two important functions that we expect from epididymis would be this is the place that sperms become mature, and this is the place that sperms can be stored up to several months. When the time comes for ejaculation, some smooth muscles that we have in epididymis contract, and they push sperm into this very long pathway that takes sperms inside the pelvic cavity. We name this very long pathway Ductus deferens or vas deferens. Its length is about 45 centimeters. That equals 18 inches. Ductus deferens runs through a supporting structure that is called spermatic cord. As you notice, inside the spermatic cord, aside from ductus deferens, we have testicular artery, we have veins that drain blood from scrotum, we have autonomic nerves, lymphatic vessels, and also we find some skeletal muscles named cremaster muscles. Cremaster muscles are extensions of internal abdominal oblique muscles, and when it's cold, cremaster muscles contract, they pull scrotum up. When scrotum is elevated, it gets closer to the pelvic cavity to get some heat from pelvic cavity. So clearly, the location of testes, which would be inside the scrotum, outside the pelvic cavity, and having dartos and cremaster muscles in the scrotum helps regulating the temperature inside scrotum, which is appropriate for spermatogenesis. The temperature that is appropriate for spermatogenesis is about 2 to 3 degrees of Celsius, lower than the temperature inside the body. Now, I follow ductus deferens. I see that this long tube ascends, goes up. It passes in front of the pubic region of the hip bone, then goes above this part of the hip bone, enters the pelvic cavity. As you see, ductus deferens sits lateral to the urinary bladder. These are the fat tissue, adipose tissue that we have. We know that fat tissue is great in absorbing shock and protecting these organs from trauma. And also the fat tissue helps these organs to stay firmly in their locations. Then when we follow ductus deferens further, we see that it passes medial to ureter. That would be the left ureter in this model. Ductus deferens runs medial to ureter and goes behind the urinary bladder. And we note that the end of ductus deferens, which is behind the urinary bladder, is wider. We name this part of ductus deferens ampulla of ductus deferens. When I look at the model, I can see that the ampulla of ductus deferens is posterior to the urinary bladder and anterior to the rectum. Then we note that lateral to the ampulla of ductus deferens, we have a large gland named seminal gland. Male genital system has 2 seminal glands. This is the left seminal gland. So both seminal gland and ampulla of vas deferens are sitting between urinary bladder and rectum. Seminal glands produce an alkaline secretion named seminal fluid, and that would be about 60% of the total volume of semen. The alkaline secretion of seminal glands help neutralizing the pH of male urethra, because that's the pathway that we use for sperm to be ejaculated out. And also the alkaline secretion of these glands help neutralizing the acidic pH of female genital tract. Seminal gland has a duct. When the duct of seminal gland joins ampulla of vas deferens, together they form a pathway that runs through prostate gland. It would be a pathway that runs through prostate gland and brings secretion of seminal gland and the sperms that pass through the ampulla of vas deferens into urethra. Prostate gland is a gland that sits below the urinary bladder. Obviously, we have only one prostate gland. Its size is the size of a golf ball. It is interesting that after birth till puberty, the prostate gland expands. It grows very slowly, but after puberty until age 30, the enlargement, expansion of prostate gland becomes rapid. After age 30 until age 45, we see that the size of prostate gland does not change. But after age 45, in many male, prostate gland continues enlarging further. And considering that we know part of the male urethra passes through the prostate gland, when prostate gland enlarges, it compresses the part of urethra, and as a result, it interferes with the flow of urine. Prostate gland produces about 25% of the total volume of semen. And let's note that the secretion of prostate gland is slightly acidic. So recall that the secretion of seminal glands would be alkaline, but the secretion of prostate gland is slightly acidic. As soon as we open the model through mid-sagittal section, we see prostate gland sitting below the urinary bladder, and we can see that the first part of urethra passes through prostate gland. Please recall that male urethra is divided into 3 sections. The first part runs through prostate gland. It's just about 2 to 3 centimeters. We name this prostatic urethra. The next part of urethra is very short. It's just about 1 centimeter. And this part is not inside prostate gland and is not inside penis. We name this section membranous urethra. And the longest part of urethra runs through penis. It's about 15 to 20 centimeters. And we named this part of urethra spongy urethra. And when we follow the spongy urethra, at the end, we see the external urethral orifice. That would be the opening to the exterior for urine and also sperm and semen. So now I go back to prostate gland because I can see the pathway that forms when the duct of seminal gland and the ampulla of vas deferens both join together. We name this pathway ejaculatory duct. So when ejaculatory duct forms by fusion of duct of seminal gland and ampulla of vas deferens, it runs through the prostate gland. As you see, it goes anteriorly and inferiorly, terminates at prostatic urethra. Please keep in mind, in ejaculatory duct, we receive seminal fluid, which would be the secretion of seminal gland, and also we receive sperm, which passes through the ductus deferens. When we get inside the prostatic urethra, before moving on, let's acknowledge that prostate gland also secretes a fluid, so that would be 25% of the total volume of semen. And then we move into membranous urethra. Please note, very close to membranous urethra, we find two very small glands named bulbourethral glands or Cowper's glands. Right now, I'm pointing at the right bulbourethral gland. Even though bulbourethral glands sit lateral to membranous urethra, when we follow their ducts, we see that the duct of this gland empty its secretion into spongy urethra. So in short, bulbourethral glands sit close to membranous urethra but secrete into spongy urethra. Secretion of bulbourethral glands forms 15% of the total volume of semen. The secretion of bulbourethral glands is alkaline, which helps neutralizing the pH of male urethra and also female genital tract. And also in the secretion of bulbourethral glands, we can find a very large volume of mucus, which is great in lubricating the pathway that is used for ejaculation. The mucus is used for lubricating the end of penis, which is necessary during the sexual intercourse. Now, when we get inside the spongy urethra, we note that we have sperm because they pass through ductus deferens. We have secretion of seminal glands, prostate gland, and bulbourethral glands. So we have the semen completely, and the pH of semen is about 7.2 to 7.7, which an alkaline pH in semen is absolutely necessary to keep sperms safe. We continue the journey through spongy urethra, and as I mentioned, eventually the sperms will be ejected out through external urethral orifice. Now that we have the mid-sagittal view of penis, we notice that inside penis we have some long cylinders. For example, in this half of the penis, I can see this very long cylinder that has a pink color and it contains the spongy urethra. Also, I can find this cylinder that is located laterally. In general, inside penis, we have three strong cylindrical masses. The strength of these cylindrical masses is due to collagen fibers that they contain. We name the one that holds spongy urethra, contains spongy urethra, corpus spongiosum penis. One of the main responsibility of corpus spongiosum penis would be keeping spongy urethra open during ejaculation. We name the other two cylinders that we have corpora cavernosa penis. And please keep in mind, right now I'm pointing at the right corpus cavernosum penis. When male is sexually excited, at some point, the parasympathetic axons that run through some of the sacral spinal nerves fire signal, and those nerves release nitric oxide. Nitric oxide, as we know, is a vasodilator. So please keep in mind that at that point, the arterioles that we have stay open and blood flows in. The arterioles push and compress the veins and venules that are sitting close by. So veins and venules are compressed, narrow down. That results in blood flowing in, but it cannot flow out with the same pace. And that leads to the enlargement of penis, which is described as erection. During erection, clearly, the pressure inside the penis increases, and that would be the moment that we expect corpus spongiosum penis to use its strength and keep spongy urethra open because we are expecting ejaculation. At some point, we know that when the sexual excitement continues, some of the lumbar spinal nerves are going to fire signal through their sympathetic axons to squeeze the duct of those glands and push sperm and semen out. So that's absolutely necessary that no matter how much the corpus spongiosum is pushed, it keeps the spongy urethra open. And when we follow the corpus spongiosum penis, we see that at the end, it is enlarged. We name the enlarged end of corpus spongiosum penis glans penis. As you can see, glans penis in this model is covered by a loose layer that is called prepuce or foreskin. So we can say that this penis is not circumcised. When they do circumcision, prepuce is removed and glans penis is exposed. And that edge that we have in glans penis is referred to as corona. And before I show you another view of this model, let's quickly pay attention to inside scrotum. That would be the right testis, and we note lots of pathways inside the testis. But please recall that the spermatogenesis happens inside the seminiferous tubules. And this comma-shaped organ is the epididymis. This would be the right epididymis. Inside epididymis also we have very long coiled tubes. Recall that inside epididymis we have maturation of sperm and also storage of sperm. When we go back to the external view of male genital system, we have a better view of glans penis, which is the enlarged end of corpus spongiosum penis, and we can see corona much better. And here in the half of the model, we can see prepuce. So half of the model is not circumcised, but we can consider this half as circumcised. And as I mentioned, circumcision would be removal of prepuce, which could be partially or completely. Some healthcare professionals think that there are benefits to circumcision, such as lowering the risk of urinary tract infection, protecting against the pineal cancer, or possibly lowering the risk of some of the sexually transmitted diseases. And actually, some studies show that there has been a lower rate of infections, such as HIV infection, in circumcised males. The next thing that I would like to pay attention here is when we learn about the pathway of sperm and semen during ejaculation, and we know the important role of ductus deferens, then it would make sense what would be the goal of a procedure such as vasectomy. We have different types of vasectomy, but the goal simply is to not allow sperms to be ejaculated out. So we know that spermatogenesis takes place inside the seminiferous tubules of testes, and after vasectomy, still spermatogenesis takes place. Inside the epididymis of a male after vasectomy, still sperms become mature and stored. And also we know that at the beginning of ductus deferens, we can store sperms for up to several months. But when either a portion of ductus deferens is removed or blocked, that simply means that when ejaculation takes place, the sperms cannot be ejaculated out. So sperms stay in ductus deferens and epididymis and eventually degenerate and will be reabsorbed. What is ejaculated in a male after vasectomy would be the secretion from seminal glands, prostate gland, and bulbourethral glands. So semen does not contain sperm. The last thing in the video, when we learn about the location of these male glands, for example, we know seminal glands are located behind the urinary bladder and prostate gland located below the urinary bladder, then it makes sense in a clinical examination why we can use anal canal and rectum to palpate the prostate gland. Obviously, we have also lab examination to determine abnormal changes in the secretion of prostate gland, but the clinical examination would be done through anal canal and rectum, simply because the location of this gland is accessible through this pathway. I hope you find this helpful.